A warm good afternoon to everyone from CharmHealth. Welcome to the CharmHealth Educational Talk Series. My name is Ranjani Rangan and I will serve as your host today. Our topic today is how one mobile clinic uses cutting edge tech to bring scalability to their vaccine efforts. I am very excited to have two dedicated guests who have committed their time these past 4 or 5 weeks to share with you an efficient and scalable vaccination administration solution.
CCVNA is in Monterey County. Monterey County is on the central coast of California. It is a very diverse county, a very diverse community, not only socioeconomically, but also geographically, which includes Monterey Peninsula and the Salinas Valley. We also have always provided mass vaccination clinics, and those mass vaccination clinics can serve up to 500 people in one clinic. And that created an issue for our documentation system. We knew that we were losing money because we weren't capturing insurance data correctly, and that there was a great deal of time spent by our revenue cycle to try to capture payment. And then as COVID came on board and we needed volume and we needed efficiency, we started searching for a way that we could get away from paper pencil and implement some kind of electronic medical record. There were no mobile products that we could find until we came upon CounterMind and then integrated with Charm.
So Mobile Intelligence Clinic actually arose out of encounters with Denver Public Health and some mass vaccination campaigns in 2009. I think it was H1N1. And afterwards, they found themselves overwhelmed with the paperwork and dealing with the problems of getting that data entered quickly and accurately.
The system has been brilliant in terms of creating a touchless system, something that was efficient, and something where the workflow started with the introduction of our health and safety questions and ends with billing insurance and sending information to the immunization registry. It is a complete flow, very smooth. In a word, it's been brilliant.
The VNA did what it does best Friday. It efficiently vaccinated nearly 300 people by bringing the vaccine right where it was needed.
It's easy. I mean, I didn't feel it. She just is that it's done.
Nuala Obama lives at Marina Manor, and she wanted to say a big thank you to the VNA and CHISPA for getting her the vaccine.
Our clients are happy to provide a driver's license that you can scan the barcode on and it populates a consent. They are happy to provide their insurance card only once. It has saved so much time and money for us.
We had a day where there was some outage and we were able to say, well, just work in airplane mode today. And it worked brilliantly. The next morning, we were able to go back, run a sync from the tablets that had collected data, and the data all flowed in. I was thrilled at how that worked out.
The most important thing is that we have been able to manage volume. The numbers that we have been able to see in a short period of time has made a huge difference in our COVID outreach. This has exceeded our expectations, and when we were able to find CounterMind and Charm and bring them together, it has made a huge, huge difference for our practice, both in the clinic and in mass vaccination settings.
We have Andrea Zutzma. Hello, Andrea. Thank you for being with us today.
Good afternoon.
Good afternoon. She is a leader in her organization, and she has played a crucial role in the success of Central Coast's Visiting Nurse Association's vaccine efforts, steering the efforts of vaccine administration during a very critical months of COVID. She is the director of Central Coast Visiting Nurse Association. She has dedicated more than 22 years of her life to servicing the populations of Monterey, Salinas, and the surrounding counties. We are thrilled also to have Chuck Kretzinger. Hello, Chuck. Thank you for being here.
Hello, Ranjani.
Hi. So he is the CEO of CounterMind, and he has been working closely with both CharmHealth and CCVNA to ensure the success of the vaccine efforts these past couple of years. Chuck is here today to share the tech and the detailed workflow processes of the vaccination solution, Vaccine Clinic in a Box, which is essentially a brilliant and streamlined software integration between CounterMind and CharmHealth. And honestly, it's been amazing to work with both of you, both of these individuals, these past few months in preparation to present the success story of CCVNA's vaccines administration solution. So please welcome our wonderful guests. A little bit about CharmHealth. CharmHealth, as many of you in our attendees know, is a cloud-based digital health platform. It's there to empower medical groups with clinical tools and technology and improve provider experience and patient outcomes. We are a tech company that works with clinics of all sizes and specialties. Gartner Digital Markets, so one of the most trusted and prestigious research and advisory firms, has awarded CharmHealth for both customer satisfaction and usability for multiple years in a row. It is Meaningful Use certified, HIPAA compliant, and it has all the high-end features of expensive EHRs, fully functioning with practice management, telehealth, patient portal, appointment scheduling, inventory management, and custom intake forms for pre-existing conditions that serve patrons for very specific needs. You name it, it's there, and our users have consistently rated it as highly intuitive, easy to learn, and an affordable EHR with all the bells and whistles. And Andrea, so I'd just like to get right into the story. Here we are in the middle of the worldwide pandemic. Clinicians need to make critical decisions in real time. There is a lot of pressure. With your experience of over 22 years, you're a founder of the VNA International Travel Immunization Clinic, a leader in American Travel Health Nurse Association, and a participant in the National Adult Influenza and Immunization Summit. You have a lot of experience with vaccination.
This is true. And from my professional contacts in the world of immunizations, I realize that there are others in our situation who could benefit from the work we have done with CounterMind and CharmHealth to create a vaccine clinic in a box, and thus the genesis of this webinar. So thank you for inviting me and presenting this.
This is very important. Thank you so much, Andrea, and it is greatly appreciated. Your work with CCVNA, a little bit about, you work with CCVNA and a little bit about them. They are a community health organization. It's been around since 1951. In fact, you just finished your 70th anniversary just before COVID hit, if I understand. For a little bit background for our attendees as how all of this began, in February 2021, Monterey County reported over 40,000 COVID cases per day, with more than 80% of the COVID-19 deaths occurring in people over 85. And this is a time when vaccinating older adults was the government's highest public priority. Can you tell us, Andrea, a little bit about the location that you serve, the demographics, and the non-traditional vaccination settings that you work in?
Right. Many people are familiar with Monterey County. It's on the central coast of California. And Monterey County is quite diverse, both geographically and socioeconomically. We service the Salinas Valley, known as the salad bowl of the world. It is a large rural area. We provide vaccines for field crews and employers such as Driscoll's, the berry growers, and Ocean Mist Farms, well known for their artichokes. For these agricultural businesses, we go into the boardroom and out into the field or coolers. And then over on the Monterey Peninsula, which is well known for world-class golf, and perhaps some of you saw us last weekend at the AT&T Pro-Am tournament, we provide immunizations to the Pebble Beach Company and the Monterey Bay Aquarium, as well as schools, residential care facilities. And we offer visits in the home to provide vaccines to people who are homebound, as well as curbside and drive-through clinics at our office here in Ryan Ranch, Monterey.
So from my understanding, you serve a lot of homebound people, many people who should get vaccinated and cannot travel to medical facilities, clinics, and other public locations that are set up for mass vaccination. So you started this vaccine clinic in a box a little bit before COVID, Andrea, as I understand it, and it was for mass flu campaigns. That is so fortunate. It was all before the chaos of COVID. For our audience, can you tell us a little bit about your previous system that you used and the challenges that it posed?
So you can imagine, and I'm sure many people in the audience can relate to this, that until 2020, we collected consent and data using a paper pen or paper pencil method, and then filing information in a manila folder. And needless to say, this system was outdated, lacked efficiency, and was not sustainable. So we implemented this system, the vaccine in a box, vaccine clinic in a box, in just 10 days. We launched it in September 2020, just before our seasonal flu campaign, and not knowing that in 2021, we would then provide over 30,000 immunizations in the era of COVID. We simply could not have provided our community with COVID vaccines without this system. It was one integrated solution, streamlined to collect data at the point of care, report to the immunization registry, track inventory, and one-touch claims billing. And it allowed us to successfully meet the demands in our diverse community and provided a cost savings to us on all levels.
Wow, Andrea, thank you. And under your leadership, CCVNA quickly implemented a very easily deployable, scalable, and also affordable solution to bring vaccines at pop-up sites to serve this population. Let's go a little bit into that solution. It is essentially an integration of CounterMind and CharmHealth. CounterMind, a little bit about CounterMind, it is an award-winning mobile intelligence platform. They build customized mobile solutions that optimize workflows for mass vaccination, patient screening, healthcare work monitoring, and patient self-service processes. And combined with CharmHealth, an EHR company, it was really a timely collaboration. And CharmHealth's API program, which offers a comprehensive set of APIs that allows medical applications and devices to interact with CharmHealth seamlessly, CounterMind was then able to integrate with Charm, resulting in Vaccine Clinic in a Box. And to help us better understand the function of CounterMind, Chuck, can you delve a little bit into the Mobile Intelligence Clinic?
Sure. So Mobile Intelligence Clinic is a mobile app that is used at the point of care. And Andrea touched on a number of those different points of care that could be in a senior living facility, could be in the field with farm workers, could be in a clinic setting or in a drive-up setting. And wherever that may be, this mobile app allows you to capture that customized data using a customized workflow in a way that's fast and accurate and very detailed at the same time. It's already been integrated with CharmHealth and one other EHR and provides a multiple layers of security to make sure that all patient data is strongly encrypted and protected. And perhaps one of the surprising features or differentiating features of this product is that it works with or without network connectivity. So we were able to, I think that was in the introduction video, we were able to keep up and running even when network connectivity isn't an option, or go into remote areas where there is no such connectivity.
That's fascinating. You know, the fact that you can do this without Wi-Fi is great.
And then a little bit more about the app. It flows naturally through the patient encounter. So the whole workflow is designed to flow the way you would work with the patient in front of you. It takes you through the registration process, screening processes, consent forms, et cetera, all the way to the treatment. And to facilitate data capture, it does things like scan the driver's license to get the patient's demographic information. It can scan the insurance card to fill out insurance information. And it can scan vaccine barcodes to get details about the medicine that was administered. And one other differentiating feature from other similar products is the ability to add new questionnaires and forms and treatment details without going into software development activities. There's a special layer for that. I think some of this will come to life if we show the video that's coming up.
Absolutely. So I believe the video is going to come right after the slide, but here's a cool infographic that really shows how the data flows from the patient record all the way to the immunization registry. And there's no more intervention other than a single click that takes place with the claims, and they're all sent in bulk, and they get sent out to the payers. And as you said, Chuck, let's just look at that illustration of the complete workflow of the video that you put together for us.
Let's start off by taking a look at the mobile part of this solution, the Mobile Intelligence Clinic. We will look at a complete workflow where during the course of interacting with our patient, we capture all the necessary data to bill them, to screen them, and treat them. During the course of registering the patient, we can either look up an existing patient by their birth date, or we can scan the driver's license to capture important demographic information. On the back of every driver's license in the US is a barcode that contains what we need in terms of name, address, birth date, and gender. We will then fill in a few additional pieces of information, take an image of the insurance card, get a good, clean, focused image of the front and the back, optionally. Then we'll fill out a few insurance details, but having the image handy, we'll know it's a group health plan covered by United. The group number is on the card, so that information has already been scanned in from the card, as has the member ID number, which is right here. And then, since it's our own insurance, we can move forward from there. Next up, it looks like I missed putting in a phone number. Then we would go into screening questions to find out about their health and decide if this vaccine is appropriate. I'm not going to go into detail about the questions, but they're standard COVID screening questions. And we can also capture information about consent, including the patient's signature. Then we go on to choosing the vaccine. I'm going to work with the Moderna vaccine. And here we would choose that this is dose 1 of 3, the injection site, who administered it. It already remembered from the last time. And then it remembers the last lot number I used, but I'm going to go ahead and scan the vaccine vial to get the lot I'm using today. So from the vaccine file, we capture the lot number, expiry date, and manufacturer. And then we're done. Save that, inject the patient, send them on their way. Here we can actually use a mobile printer to print a receipt for the patient to have. And then we're ready to treat the next patient while this data flies off to Charm. Now let's take a look at the data in Charm that came over from the mobile app. First, we'll go to the patient. And from this patient's record, we'll be able to see that the demographic data from the license was captured. Questionnaire has been captured. Insurance details have been captured, including the images that we just took. We can then look at the encounter itself and see that there was an encounter created. It contains the vaccination as well as the appropriate procedure code for administering the vaccine. Under vaccines, we can see that that vaccine is there, and here that it's been queued for submission to the immunization registry. And then, very importantly, we can see that there was an invoice created automatically, and that invoice has an associated claim with all the details from the treatment that was administered. And that will be submitted and in batch and sent over to the payer for payment. So as you see, everything to start off by to treat the patient, bill the patient, collect payment from the payer, etc., is all captured at the point of care and then flows seamlessly through to the back end. And Charm pulls that all together into a coherent electronic record.
Now here's a great video showing a real-time situation. Thanks, Andrea, for this video. And so here, I'm going to go ahead and play this, and this will give a good idea how it's in action. There we go. And that is a wonderful video. I really enjoyed watching that. So to summarize, here we have the entire process. You have the rapid collection and transfer of patient data at the pop-up site, and this enables the nurse to quickly register individuals, administer vaccines at the point of care. Patient demographic, insurance information are stored in the system and can be retrieved during follow-up visits during using a patient's driver's license or date of birth. And then using data automation, all the vaccine information are sent to the patient's medical record for additional processing, and then it's followed up with the generation of invoices and claims ready for submission. And in addition, we have the inventory management where you can accurately and quickly plan your vaccination schedules, forecast your vaccine supply needs, and generate required regulatory reports. Then we have the claims management where you can do a single click with the claims. So CCVNA can do a bulk submission of the claims after their vaccine administration. And of course, with respect to the reporting, COVID-19 vaccinations would be reported within 24 hours of administration, in this case to the California Immunization Registry. And as well, the reporting was important so CCVNA can invoice their donors and agencies on time. And Andrea later on will go into the importance of reporting with respect to the people who were her funders as well. Here's a little screenshot of our analytics page in the CharmHealth side. And Chuck, if you'd like to talk about this briefly, I think this is the actual analytics of CCVNA. Or was this Andrea? Andrea, would you like to talk about it?
So this is actual, and as you can see, in the month of March, we peaked, like many of you, during the COVID vaccine immunization outreach. And then there in October was our intent to do all our flu vaccines as much as we could before November when the COVID booster was approved and implemented. So it gives you a good illustration. And the analytics are used repeatedly. Not only can we look month by month, but we can look day by day, or we can look at provider. When we have done the home visits, our funder wanted to know, how many home visits have you done? So we created a clinic code, which is added to the MI clinic. We select that clinic code, and then later we can look at the analytics and determine how many home visits we did in a day, in a month. It's really helpful. Also for employers, when we go to an employee work site, the employer at the end of the day wants to know, how many vaccines did we give? How many were first dose? How many were second dose? So the analytics really assist us in results reporting.
Thank you, Andrea. And here is another screenshot of our inventory management. And Andrea, if you'd like to speak to this and how
the inventory management really saves us a great deal of time because we have par levels. So as you indicated earlier, we can see when inventory is getting low. It's helped us to keep track of the various different COVID vaccines, and it's you know, at the end of the month, it's very easy to generate the report for our finance department as to how many vaccines we actually administered and what our PAR levels are.
Thank you. So there were several positive outcomes that came out of this as well. And, you know, this is a time when, you know, over a 12-month period, CCVNA vaccinated 25, and I believe you said right now 30,000. That might be an updated number, vaccinated and reported to CAR over a 12-month period. Here are some of the statistics that all came together. So at peak, you vaccinated 7,000 patients during your peak month. So you were able to scale quite a bit, and you were able to submit claims, about 4,500, quite easily, and receive reimbursement. And as well as the number of patients per hour one nurse could take care of, which is 15 to 20. Andrea, could you then, if you can, talk a little bit about some of the other positive outcomes that you might have experienced that you didn't expect, maybe?
There were many. First of all, as I mentioned before, the touchless during the era of COVID was brilliant. People could just hold their driver's license and we could scan it. So we didn't have to touch anything, and they didn't have to touch anything. That really made a big difference, especially when we initiated the COVID vaccines. The other thing, when we were showing that small video, you saw that there were two practitioners there, one vaccinating and one doing the data entry. And we hadn't anticipated that we could have cost savings when we had a clinical person doing the data entry and the nurse or clinician doing the actual patient education and actual vaccination. So that was an unexpected outcome. In addition to that, in the rural areas that we serve or in the diverse community that we serve, we often need a bilingual practitioner. And so if the clinician is bilingual or the clerical person is bilingual, one of them can be doing the interview with the patient and the other doing the data entry, one person doing the interpreting. So it was really an unexpected outcome that we would have this combination. And everybody is cross-trained. So even if a nurse goes out on her own, she knows how to do all the data entry too. In our standalone clinic, in the travel immunization clinic, the nurse does her own data entry. And in the home, the nurse does the data entry. In a really active, busy clinic, you saw the picture of a drive-through clinic. And during that clinic, we do what we call a divided workflow. And so people come first to the station where they present their insurance information or their form of payment and their driver's license. The clerical people do all the data entry and create a QR code that is given to the patient or the participant or put on their windshield. They come up to the next station, and at that station, they receive the vaccination. The nurse or the clinician scans the QR code, everything is populated in the iPad, and then they proceed by just entering the information about the actual vaccine that's been administered. So that was really a wonderful feature. The other thing that was really brilliant that you mentioned was that being able to see people for their second dose or booster dose, or any subsequent visit, we can bring them up in our system by date of birth without having to rescan the driver's license. We can bring them up in our system. We know that they've been there. We also already have their insurance data on file, so we don't have to re-enter the insurance data. It makes it really quick and easy. And for the client, it's so satisfying because it's just so simple. So we use date of birth retrieval, and it also has prevented duplicate records. So if you scan the barcode on the driver's license again, it can create a new record. But by using this date of birth function, we're able to prevent that from happening. And then one other thing that I want to mention is this sticky feature. And Chuck mentioned that. But once a barcode has been scanned from the vaccine vial, it's on the iPad for that encounter and for the rest of the clinic. Same thing with the clinician who's administering the vaccine. You don't have to keep changing who's ever administering or what the vaccine is. It remains sticky. And that feature really eliminates repetitive data entry and it assists in the efficiency of the.
Thank you, Andrea. Looks like there's a lot of automaticity, data automation happening, and then being able to keep your patients in a, not having to wait too long. And I guess that's why you're able to see so many people. One nurse is able to see so many. And the fact that you have that divided workflow really contributes to where you can allocate your resources.
And as I said, the inventory and analytics are just invaluable in providing reports and follow-up information to clients, employers, and grant funders. It really is a total package.
Wonderful. And I just wanted to, we're just about to end our presentation here, and I just wanted to, add in this quote that Chuck had given me a while ago, and I think it's very appropriate. It represents the Charm and CounterMind partnership. Our partnership with CharmHealth has allowed us to provide a workflow for vaccination campaigns that is unique in its ability to convert data captured during the patient encounter into claims without any additional handling. And I think that's the key. It's no additional handling. Data flows seamlessly from the encounter to the claim in a matter of minutes, resulting in less work and faster collections. This is a great summary, very succinctly put, and I just wanted to add that in. And this would be a great moment as we end this webinar. We're going to take question and answers very shortly. I just wanted to thank Chuck and Andrea from the bottom of my heart for taking the time for out of your busy schedule to be the guest speakers for this webinar. Your presence and sharing your experience will definitely help clinics down the way. It'll definitely serve as an inspiration to our listeners. Thank you so much, Andrea. Thank you, Chuck. Appreciate it. One question that I do have here is, Andrea, can you go into talking about the funding from various sources, how you were able to secure that funding to bring this technology to help serve the community?
Right. That's an excellent question, because as a standalone not-for-profit organization, we didn't have access to an electronic medical record. And so that's why we went on a mission to find an electronic record to meet the needs of our diverse community. And we had a limited budget. So we needed to be fiscally responsible in our research and our implementation. And the implementation was pretty easy, actually. The training was easy, bringing people on board. The ongoing orientation as new people come on board is quite simple. But funding was also something that we were asked to seek. And we went out to a couple of local funders, and I would encourage others, this was a good time because there was a great deal of COVID funding. There was a great deal of COVID monies to be shared, and that's what we used for enhancing our services. And we also went to larger groups like the United Way and asked them for funds to assist us in implementing this system. So there are people out there, and I think as communities and entities are more aware of the needs for vaccinations and immunization services, there will be an impetus for funding for groups like.
Thank you. I have another question here. We're looking to implement this in our clinic. How long will this take to deploy?
Take a stab at that one.
Oh, sure, Chuck.
We've been discussing being able to drop in this solution as it is in a 10 to 14-day window. And then once we have that up and running with a new customer, we can go into setting some timeframes for whatever customizations may be required.
And that was certainly our experience.
Wonderful. Thanks for answering that. And I have another question from Melissa McClung. What triggers a submission to the immunization registry? Chuck, if you'd like to answer that, yeah, go ahead.
I'll take a stab at that. That's actually a setting that, in this case, the way it's configured right now, it's automatic for the COVID vaccines to be forwarded to the immunization registry. But it's vaccine by vaccine. It could be turned on or off, and that's the way we set it up for this particular situation. But it could be a manual setting in my clinic too that would easily be added to where you could choose a yes, send this one, or no, don't send this one.
All right, wonderful, Melissa. If you have any follow-up questions, feel free to ask them. And Nicole is asking, what if a patient does not have insurance?
So if a patient doesn't, in the era of COVID, we have a federal fund that we would bill for the administration fee, and we just have that in our drop-down menu. For people that don't have insurance, we also went to funders to have it funded. Or if you have, sometimes an employer is covering the cost of the vaccine for their employees. So those options are all there, and then it goes to it flows over to our billing, and then the bill is generated on the back end from Charm. We also collect cash, check, or credit card, and we use Clover is the credit card machine that we use. It's like a cash register that we can enter cash in, check, or credit card. I hope that answers the question.
And some of these things can also be taken care of within CharmHealth as well.
Mm-hmm.
And I have another question from Nicole. How do you get started with vaccine administration if this is a service that I want to add to my business? I would suggest that you email us at myvaccineclinic@charmhealth.com, and then we will set up a call with you and understand your processes and your timeline. And we will then give you, that'll be the next step, I guess, would be the best step for you to take. Right after this, you will receive, along with a copy of the webinar, you'll also receive a place where you can add in your information, as well as some details about your clinic as well to get a conversation started. Hope that answered your question.
And there are some excellent professional organizations in the world of immunizations that support startup immunization.
Oh, wonderful, Andrea. Did you want to, was there some specific names you wanted to share?
No, but at a later time.
Okay, sure. Yeah. Sounds great. And a question from Melissa. You mentioned that a clinic can be up and running in 2 weeks. What are the activities involved? What staff roles should be included? Chuck, would you like to try that?
Sure. So we would need to work with some IT staff, particularly that MI Clinic has a server component to it that needs to be installed on premise. Or if we agreed to work together, we could get it installed in the cloud somewhere. But in the case of CCVNA, we installed it on premise. We worked with the IT staff to get all those pieces installed and up and running. And then there's the interface from that to Charm is all through the cloud. So it's going to be pretty automatic once we have that up and running. Just need new credentials for each customer, and that's a trivial process.
While we're waiting, I'll mention another thing that was an unexpected outcome. For many of you who have administered the COVID vaccines and document on the COVID vaccination card, the CDC white card, people lose them, and then they're calling. And just to be able to look them up so easily and recreate the card and mail it off to them, or have them come by and pick it up, or send it to their employer, that was just a reward in itself.
Yeah, absolutely. Thanks for adding that in, Andrea. So we had some wonderful questions there. Thank you so much. Thanks, Andrea and Chuck, for answering those questions.
It's been a pleasure working with you guys to put this discussion together, as well as to have this solution out there and up and running. CCVNA, I'd like to thank for being a great contributor to the direction of the product. They've had a lot of input as to what worked best in the field and how to make it. We've gotten ever more streamlined since we went live to where today it runs very smoothly. And thankful for that. And a quick shout out to Melissa McClung, who we've worked with in the past on other MI Clinic implementations.
Fantastic. It has been such a pleasure, and it's been an honor to work with both of you. And I hope that these solutions go far and wide, and people are able to administer their vaccinations in a smooth and seamless way, such that they can have less administrative burden And thank you so much, Andrea. Thank you, Chuck.